Hey there, Dr. Christianson here, and I want to talk about how to get your thyroid dose right for good energy and good weight loss. This is super important, and it's something that's not intuitive. It doesn't seem obvious. You know, if low thyroid can mean that you're tired and gaining weight easy, you would think that more thyroid can reverse that. And maybe it can, but there's a point at where it could even make it worse. I want to go deep in how you can know where that all is. So please do a quick review on thyroid labs. There's the TSH, the free T3, the free T4, the thyroglobulin antibodies, thyroid peroxidase antibodies, thyroglobulin, reverse T3, all important. We're going to talk mostly about the thyroid antibodies, free T3, free T4, and TSH in this context. So you want to get good testing, you want a good full panel done, and you want to have that done before you've taken your day's thyroid tablet for it to be meaningful. So as long as you do that, we can make sense. Now, what happens is that TSH scores, they run higher when you're low in thyroid and lower when you're high in thyroid. And the free hormones are more direct. So less thyroid means less free T3 and T4. More thyroid means more free T3 and free T4. So far, makes sense, right? Now, here's where the wrinkles come in. So the TSH, the normal range, you may know it doesn't really apply that well. And that many who are in the normal range but on the high side of it are still hypothyroid. And people that have good thyroid function are normally on the low end of that normal range, like between about 0.4 to 1.5. So whenever you're 1.5 to 4.5, you're more apt to have hypothyroid symptoms. Now, people often assume then that the free hormones also should be higher in healthy people. So one difficulty is that that's not happened. So large studies that have looked at the distribution of blood scores in healthy people have shown that their free hormones aren't on the highest side, that they still have as much fluctuation as everyone else does. And here's the big factor. The main concept is that you control your thyroid by regulating how much hormone it releases, but you also control how your body uses that hormone. And these are so powerful, thyroid hormones are so powerful that even after they're made, you can get rid of them faster, you can hold on to them longer, you can do all these various things to fine tune at a cellular level. You can almost think of it like the federal government and the local government, and they're all controlling what economics in various ways. So the local government, the local tissues, your liver, your kidneys, your cells, your mitochondria, the cell membranes, they can all do stuff to make you use thyroid or block thyroid. And when you get above some sweet spot, all those things, all those local government type things start to block thyroid. And what happens is you can feel like there's too little thyroid when there's too much thyroid because your body's working hard to block it. And here's the vicious cycle, and here's the pitfall. So all that local government stuff, that might take a couple of weeks to kick in. So say someone is on a dose that may not be quite right, and they adjust it. Maybe they went up by more than they needed to. Maybe they took a strong step up. And for the first little bit, before all those blocking things kicked in, they were closer to where they should be. And they were feeling a lot better. Like, hey, my energy's back, I'm thinking clearly, my weight's starting to come off. But then all that started to screech to a halt. You know, they started thinking, hey, I've lost all these benefits. And between themselves and their doctor, it seems so obvious that raising the dose was what got them out of that for a little while. And that seems like the most logical way to go. So they might raise the dose again. And hey, oh wow, it's working, I'm feeling great, all these good things are happening again. But then they drift, then they go away. And we repeat this. And there are things you can find, there are various writings that argue that this is a safe approach. You can keep on taking more and more and more, and unless there are obvious palpitations or obvious short-term side effects, there's no real harm to that. And there's actually very detailed, articulate, persuasive arguments that say how you can ignore the lab tests. Some will say you can ignore the TSH to get low. The first thing that happens when you get too much is your TSH creeps down, and the free hormones won't yet rise. And that's because your local government is still getting rid of the excess. There's none that's built up yet. So even though your body wants less, the TSH is lower, it hasn't gone over the dam, so to speak. So the free hormones wouldn't rise. But so one group will articulate that you're okay as long as the free hormones don't rise. The TSH being low, you can ignore that. Others will go further and say you can ignore all of it. Even if the free hormones are high, you can ignore all of that. Well, I want to say two things, one of which is that it's dangerous to ignore either of those, low TSH or high free hormones, even just the low TSH. We've got large bodies of data from people who spontaneously have low TSH scores or who, from past guidelines, were given higher doses of thyroid to try to prevent cancer recurrence. And both of those populations of people, they don't fare well. They have more total mortality, they have more heart attacks, they have more dementia, they have more hip fractures. And that's only with a low TSH. That's not high free hormone levels. So it's a dangerous thing. That's the one point. The second point, it's not an effective strategy in terms of energy or weight loss. It just doesn't work. All you're doing is making your body deeply resistant to thyroid hormone. And it's a vicious cycle. There's some point at where either when you first change a dose or you're finally on some crazy, crazy high mega dose that now you overcome that thyroid resistance. But the drawback is it's only a thin margin between that and then just obvious hyperthyroid side effects. There's some point at where you don't feel well. Your heart's racing, you're anxious, you're getting tremors, obvious hyperthyroid side effects in the short term. And I've also seen people get pushed into Graves' eye disease from thyroid overdoses. So that can happen. But yeah, the strategy is not effective. And in terms of being at the sweet spot, you do want to have healthy levels of free T3, free T4, but you want your TSH reasonable. You want it, I'd argue, on the lowest end of the range, but in the range still. So somewhere about 0.4 to 1 if you've had enlargement of the gland or structural problems, and probably okay as high as to 1.5 if you're feeling well. If not, a tad lower is fine. Now, there are those who will say, but I only feel well when the TSH is low. That's real. That's important. You should feel well. But what's happening is there's some reason by which your body is thyroid resistant. And it may be just as simple as taking too much. I've had many people to where just the gentlest, most appropriate dose reductions with a good medication change. So oftentimes a change from a synthetic to a compound that has T2, and that's clean, like WP thyroid. So with a good change, with a very gentle reduction, sometimes that completely shifts things, and now the person's feeling well again. But I have seen some to where they argue that, no, I tried it all right, but I only feel well when the TSH is low. That's important. That means something is wrong. That means one of the big root causes of their Hashimoto's has not been uncovered and has not been addressed. And I would argue that it's important to do so and not be at a state of risk. There are things like a suppressed TSH to where you may feel fine, but something is wrong. You're missing out on a root cause, but also you're placing your body at unnecessary risks for some of those complications. So please dig more deeply into that. It can be things like cortisol abnormalities or blood sugar being off or some chronic toxins stored within the thyroid, but something's not right. And you want to get to what it is, not only so the thyroid can function better, but so that other thing won't cause other complications for you down the road either. So in terms of adjusting and changing, whenever start with the TSH, and I know this is controversial. I know there are those who say we must ignore the TSH and only look at this or ignore all the tests, but please, the TSH is the first thing to adjust because it represents the federal government. It's the brain's control. The free hormones are local government. They only show change at the extremes. They only show levels get high when you've spilled water over the dam. They don't show the first levels rising. And they only show low when you're totally out. And the other factors that affect them are more local factors. They're more how your body uses those hormones. And in many cases, you intentionally adjust that based upon that total level. So you've got to start with a good amount, and that's first getting the TSH reasonable. When the TSH has been close to 1, for so many people, free T3, free T4, RT3, thyroid antibodies, they sort themselves out. They really can regulate. And again, more so when someone's on a good medication. But that's a really healthy first step. If there are still lingering issues with the other levels after that's been regulated, then it's getting deeper into some of those root causes. So straightforward thing, but yeah, more is not better. More can be less. And more can cause the exact same symptoms that less can cause, paradoxically. And less can cause the symptoms that more can cause. You can have too little and still have a racing heart or have other symptoms that might look like an excess. And it's because of that local regulation. Your body always tries to correct it when it's not right at that tissue cellular level. And the symptoms cannot predict that. So it's important to address the symptoms and help them, but it's important to know that the symptoms may not be the best indicators or gauges of how you'd want to change things. So yeah, important topic, and hopefully that's been helpful for you. Take great care and watch your scores, check your neck, check your thyroid score, and we'll talk again really soon. Bye-bye.